So welcome, everyone. What I'd like to do, Julia and I would like to do today is talk about creative grant making that we facilitated over the last 7 or 8 years, catalyzing age-friendly community change through creative grant making. We're going to focus on going in two different directions. One about the creative grant making process that we utilized, and second of all, the kind of community change that came about because of this creative grant making. We're then going to talk about what impact we had expected and what we actually achieved beyond the dollars. So what I'd like to do is ask everyone to raise their hand if you're most interested in us telling more about the creative grant making process, or if you're more interested in the community change and the age-friendly work, or if you can't really decide. So Julia, you're going to have to let me know, since I'm doing the sharing, how many of you are interested in the creative grant making process? Please indicate by raising your hand. Okay. And how many are interested in the community change and age-friendly work? And how many of you just can't decide? Okay. So thank you very much. This will help guide our discussion today because we want to be as responsive and as effective communicating with all of you.
So it looked like it was about half and half, but I think the way we've laid it out is probably going to work best with some time for questions at the end.
Okay. Julia, take it
away.
Away.
So we really launched into something new with our grant making with this program. We have given you a little idea here of how this work compares with sort of traditional grant making, at least in our experience. And Renie and I really tried to collaborate from the get-go on this program by changing the way we were designing our applications. Lucky for us, we both used the same model for online grant making. And so we really aligned all of the questions, everything that we were asking, so that we could make clear comparisons between all of the groups that were applying for a grant throughout this process. We really did that intentionally so that we knew we were exploring new territory, and so we created a whole new application just for this program. It had a lot of questions in it because we were exploring new territory, and we needed to just document what things were happening along the way. So maybe if you ask some of the grantees who were in that first cohort about that, they may say it was extremely long and difficult to fill out, but it was a learning process for all of us along the way. A lot of times grant cycles last for about a year, and sometimes they can be renewed for 1 to 3 years, but this program we recognized early on was going to take longer than that to, especially given that COVID happened sort of in the middle of it, but we extended the whole time frame of the grant program to more like between 4 and 7 years. And one of the other ways in which this is very different from traditional grant making is that typically grants are given for a special project to one organization. And in this sense, we considered this grant making to many organizations at once, with a learning collaborative taking place along the way, so that it was more of a community forming rather than just one organization receiving a grant to do their programming, which is also appropriate in certain situations. So rather than building the capacity of a single organization, we were creating a whole ecosystem in this way. And an interesting thing that we did along the way too that was different was we asked for permission to share the applications and all of the information that was provided to us in reporting along the way with our research partners at Rutgers School of Social Work, so that they could follow this process as well in their own unique way of studying and researching the process, and then give feedback so that we could learn together and make changes along the way. The cohort that started all together at one time also gave us the opportunity to have presentations that they could do together or do for each other. And it was a really nice way to set up a learning cohort, peer-to-peer learning, and also learning from outside sources as a group. Okay, let's go on. Do you think I covered pretty much the differences
Yes,
there?
I think so.
All right, let's go.
Just a second. So the two of us were very ambitious. We set out on this adventure by first doing something we hadn't done before, or certainly the Grotta Fund had not done before. After holding an outstanding conference on age friendly with national leaders, we accepted applications in which they were willing to first learn about their community and their older adults with a planning study. Once the nonprofit or the municipal leader had completed the study, the leader could identify key community strengths and opportunities, relevant community leaders, key organizations, and other partners to participate in this effort. We aimed for planning to be from the bottom up, to engage local older adults, and we really wanted a diverse representation of the population in the communities. We had hoped the community would set clear goals for areas to address and bring new innovative programs to the communities, as well as community change in things like the built community. Ambitiously, we hope the organizations would work with other organizations like education, healthcare, public health, to public safety, recreation, and housing to work together on these projects for the betterment of older adults. Most importantly, we eagerly wanted to change the image of older adults using the reframing models, and we wanted to, we hope that the age-friendly efforts would garner buy-in from municipal leaders, county leaders, and ultimately at the state level to improve policies for older adults.
Great, thank you. I just will start off by saying, Audrey Holmes, I see you. I see your hand is up, and I hope that you'll keep your question in mind so that when we wrap up what we need to share with you, you will ask. No? Okay. Okay, sorry. All right, so we wanted to share with you a little bit of the timeline for our work since 2015, because it seems to help put things in perspective, and people really appreciate this graphic. Luckily for us, we have our colleagues at Rutgers School of Social Work who are really good with graphics, and they created this for us. We've been adding to it along the way, and we feel like it's really good at showing sort of the arc of the building up of an alliance, starting with what Renie mentioned with the conference, working with the 9 communities in the beginning that received planning grants. That changed over time a little bit, and how they dealt with the period of 2020 and on during COVID. And one thing we like to point out about this timeline is that because of the build up to 2020 in creating partnerships in the community, the towns that had an age-friendly community initiative in place at that time were really much better able to handle the emergent needs of older adults in their communities by, quickly springing into action to create food provision and helping people sign up for COVID vaccines and other kinds of things that needed to be done on the spot. They were much better prepared in order to deal with those emergencies. The cohort continued to pick up sort of where they left off and add new things to their work following 2021. And you can see through this arc, I call it an arc, that there was a system in development. And it became more and more well organized and sophisticated. And with the help of Rutgers School of Social Work, receiving some grant funding to help administer it, it really kept us on track and able to reflect on what our accomplishments were and change what we were doing in response to that. So if you can show the next slide, Renie, it's sort of a continuation of that to bring us to where we are today. And again, the sophistication sort of grew. We were able to create things like Padlets. I didn't know what those were before, but to organize our resources and know where to go for help on various community challenges, and also to show how leadership was developing. We really feel very proud that the communities that have been working on this for such a long time have developed an amazing group of leaders and have reached outside of their wheelhouses, and most of them in the field of social services, to understand more about community development and how it works and how to influence people in their communities who make decisions. So that has been a learning opportunity for all of us, and we've really appreciated seeing that those skills grow, to the point that now many of them are involved in policy advocacy. They were, I will say, stars this week in participating in hearings on the governor's new budget and trying to advance policies that support older adults. So you might, if you've attended any of those, you might have seen or heard from many of the partners that are part of the age-friendly community work. Okay, Renie, we'll go to you.
So, so what kind of work did the communities do? And this chart is from the early days when we surveyed each of our age-friendly communities and said, what is the primary focus of the work that you're doing? The blue line shows the primary focus of work, with the top line, for example, showing that all of our age-friendly communities saw the need and then responded with elements, activities, newsletters, reach outs that involved information and communications to older adults in the community. As you can see, making older adults more visible, pedestrian safety, outreach to socially isolated older adults. All of our communities were involved in this. And to a lesser degree, some of the communities started out with volunteerism or housing accessibility, lifelong learning. But as the years have gone on, the communities have expanded and gone into other areas. But I think it's important to look that over time, as they focused on these later activities, they've seen the value of, first and most important, focusing on information and communications, keeping that going, looking at pedestrian safety, looking at transportation options, and now parks and outdoor spaces and dementia friendly have come into many of the communities' portfolio of activities. I'm going to stop here and see if anyone has any questions.
And that slide, although the graphic has been very important and helpful to us, it's hard to read on a screen. We recognize that. So if anyone wants us to maybe share this with you later, it's effective in showing what was actually happening, what people were actually doing to make their communities more age-friendly, but it is a little tricky to read it on this small screen. All right. So this is another collection of data points, I'll call it, from the work that Rutgers has been doing to document the work along the way. Is this slide 7, Renie? I'm sorry, I got a little bit lost.
Yes.
Okay. So Rutgers' most recent report, they have created several along the way, is about the age-friendly community initiatives in their maturity. And it includes insights on the accomplishments and the sustainability of this work over time. It was written and put into publication in December, just this past year, 2023. And the authors of that work were Dr. Emily Greenfield, Natalie Pope, who you've seen today, and Dr. Althea's Pestine Stevens. They have created many publications, but this one in particular was able to look back over a longer period of time and collect the accomplishments that have taken place. And some of the things that we really like to point out about this is that they amplify the voices of older adults in these communities. That was a really important part of this work. They encourage people to participate in things like town council meetings and have their voices heard and advocate for changes and improvements. They created ambassador groups who could go throughout the community and explain what an age-friendly community was and recruit more members to participate. And in addition to that, they participated in things like walkability studies that led to improvements in the built environment and pedestrian safety improvements in particular. Another wonderful accomplishment is that several of the towns are now looking at their rewrites of their master plans to include age-friendly practices in those. That's a way to really sustain the work and keep it going into the future by making changes to those master plans, because that has to do with things like housing and transportation and parks and public spaces. And if all of those things are planned with a lens of longevity and longer lives, then we have made a great improvement and that is sustainable. And then you can see here some of the other findings. I sort of shortened them, but the report goes into much greater detail about all of these things and the way that the leaders that we've been talking about and have been so proud of are mentoring new communities to join in this movement and are much more advocacy oriented and are influencing communities beyond their local place where they started.
Julia, Renie, I just want to jump in and let you know we have less than 10 minutes left of our breakout. And some questions are starting to pop up in the chat.
Okay,
Beautiful.
thank you. So I wanted to just draw upon this slide, which really says how embedded the age-friendly community becomes in the community and how connected it is to a larger structure. In the center, you see the age-friendly community, its group of core team leaders. Above, you see the age-friendly work is connected to larger groups like WHO, AARP, and other national groups that are in fact growing. On the left, you see that the public sector partners and residents, and on the right, the private sector. So now we can appreciate the importance of building trust with all these partners in the sector and advancing age-friendly tenants in all these partners. So it's taken a lot of time. This was an aha moment when we built this, and Rutgers helped to draw this chart of this superstructure to see that age-friendly community building and work can't start in a day. It really takes time to build trust and build relationships.
Okay, so rather than go into these personal reflections right now, because I think we've probably covered many of them as we went through the other slides, they're important. I just want to make sure we address the questions in the chat and any others that people have. And I think one way to do that, I see several questions about, whether libraries or other special groups were included in this work. So if you might go back, Renie, I don't know if that's to that previous slide where you were just talking. It's difficult for us to show all of this on a graphic, but the things that you're asking about, like the rapid growth in the older population of people who are visually or hearing impaired being included in this work, or people, libraries was super important partner in this work. We tried to categorize them on this slide. So for example, the advocacy, civic, and volunteer groups that you see on the bottom right with the hands, that includes many of those groups. And yes, indeed, they were critical partners in this work, in spreading the word throughout the community and in bringing in older adults that would like to advocate and see improvements in their communities. Intergenerational programs someone asked about, that was something we were going to talk about. Our pride is that a few of the communities have actually been recognized from other outside third-party organizations for their intergenerational work. They've also been speaking at conferences, both national and international conferences. I think you can probably hear the pride that we feel about these grantees and their accomplishments when we talk about it. I get very excited, and so does Renie. But this is because of the cohort nature of this work. They've been able to encourage each other to provide presentations in that way. So they really have grown in their skill level at presentations as well.
So I think some of the intergenerational programs, just to add to it, are things like senior proms have come out for some of the schools. Reading to children and working with children has been something that some of our communities have done as intergenerational, as well as a project in Elizabeth that worked in public housing with older adults and younger adults working together and learning together. We also used older adults and younger adults on technology training. So there have been a number of intergenerational programs, along with Generations United, that's shared with many of our communities, other opportunities for sharing. One other community has younger adults tell stories of older adults, and there's a contest in the public school system now for developing those stories in West Orange. And the question relating to hearing and vision limitations is something I think we would love to expand more into. We've asked the communities to pick out what they would like to do, but I know in the work that Grotta does and the Henry Marilyn Taub Foundation, we do really include more of the need to include the population and address the needs of those with low vision and low hearing. Anyone else want to ask a question orally versus, I can see if I can. Jim.
I know you guys pretty well. And
Hi, Jim.
Hi, Jim.
I know you've done a tremendous job. What is next on your agenda? I mean, are you thinking, what kind of expansion are you thinking of the program? To additional communities, geographically? Where do you see the movement going?
That's a great question, Jim. All those directions, we do see more communities joining at their local level and creating their own process based on their own surveys of community members. But we also see a much larger thing happening here in New Jersey, and that is that the awareness, first of all, of the older adult population and the kinds of things that we could be doing in a much more innovative way and much more differently than we do now, to create communities that are supportive of an aging population. And we're hoping that with attention from our state leadership, we will have the opportunity to build on this movement and create something that's more like what other states are calling multi-sector plans on aging, that would be even more inclusive and comprehensive than this local community work. It would include that, but it would be something of a greater vision. And we are keeping our eye towards that and also working to create the right kinds of partnerships to make that happen.
In addition to this, what we're doing, both of our foundations are doing, is trying to build up the leaders that we have in our communities to go to communities that haven't started yet to help them out. This mentoring is incredible. And we've also, I'm working, the Grotta Fund is working with the NJA, with Dorothy Sanders and Kathy Rowe, to be mentoring new communities in the Essex, Union, and Morris counties. So we really want communities to learn from each other, but also to try to start and go down the road that we felt was a real learning process of understanding community, understanding priorities, setting goals, implementing programming that really is important to the community, and then taking policies that need to be changed within their municipal plans, as well as helping us at the state level for promoting the funding that we know was awarded to go for age-friendly grants, but we haven't heard the details yet. So I was hoping Kaylee would have shared that with us today, but didn't quite hear it, but we understand there still is funding in the budget for building more age-friendly communities, and we're hoping this work will continue. We think it's so important, and we really would appreciate any and all of your help in this matter, because we see an aging community and we see the need for more communities to do this work.
Great, thank you.
Anyone else?
Lori has a good question about what other community-based organizations can do. There's an upcoming hearing for the, I don't know if they call it a hearing, an invitation to join the state's division on senior services to talk about the state plan on aging, which is renewed every 5 years. And we're thinking that the more people who can show up to that and talk about the multi-sector plan and how it fits with that state plan and how it differs, that would be one way that we could get this word out, and any other relationships that you might have with elected officials, to be talking with them about it, and bringing in your partners who are not necessarily in the field of aging, technically speaking, but whose work touches it, such as in housing and transportation, and public spaces, infrastructure. Speaking about a plan to them and getting their buy-in would be helpful too.
And we're happy to help. We're happy to share some of these reflections of what we found we have gained from the funding that we've expended over the last 7 years. We're happy to share the tremendous amount of resources that have been collected from local communities as well as other states, because we think this knowledge is worth disseminating. We've been pleased to know that more than a dozen articles have come out from Rutgers and other people, and presentations are made all the time by our community leaders. They're eager, they're great presenters, they're proud of the work that they've done, and many of our municipal leaders are proud to stand up and say what a difference this made in their communities. And I think the spinoff and the benefit of this kind of outpouring of enthusiasm from the leaders is something that's unique, that in some of our funding, a lot of times we'll see a group that's proud of their work and they keep it internally, but we've been really pleased to see and hear our community leaders going out in the public and doing this work. That's why we say this is a collaborative that was greater than 1+1, because we learned from each other, and we had the opportunity to expand the work and have it evaluated with the assistance of Rutgers as well as the national movement. So we really thank all of you that have been working with us in this space and are eager to have others join in. Happy to share the information, and we are continuing to bring our groups together to share their successes and keep learning. If any of you would like to be a part of those learning sessions, please let us know. Any other questions?
Oh, good timing.
Any other questions before we get pushed out of the room? Again, thank you so much for being a part of this. And I thank my partner, Julia
Thank you.
Stoumbos, and the Henry and Marilyn Taub Foundation. We could not have done this extensive work without this incredible partnership.
Yes,
So thank you.
Thank you. It's been a lot of fun.